Good afternoon. My name is Paul Edwards in the Governor's Office, and we'd like to welcome you to this afternoon's briefing. We're very grateful to our media partners for the effort that they make to provide these briefings to the public so that we can get timely and accurate information to the public on a regular basis. Today's briefing, we'll hear first from Dr. Angela Dunn, our state epidemiologist, with an update, and she can answer questions. And following Dr. Dunn, we'll hear from Commissioner of Public Safety, Jess Anderson, who is the incident commander over the state of Utah's Unified Command for the COVID-19 incident. He'll be accompanied by John Gleason, who's a public information officer at the Utah Department of Transportation, and Joe Dougherty, who is with the Department of Emergency Management. They'll be providing some updates on the required declarations at Utah's points of entry. Dr. Dunn.
All right, good afternoon. We are up to 2,102 Utahns who have been infected with COVID-19. That's an increase of 126 from yesterday, or a 6% growth rate. We've tested now 40,762 Utahns for COVID-19, an increase of 2,389, and we're still at that 5% positive rate. We have 183 hospitalizations so far for the entire outbreak. We do now have 17 deaths. That's an increase in 4 deaths from yesterday. All 4 were in individuals older than the age of 60, and they were all male. 3 were residents of Salt Lake County. 2 of those were from a long-term care facility, and 1 was hospitalized at the time of death. And the 4th death was in a Utah County resident who was hospitalized prior to death. We really need your help in getting the word out that the state of Utah now has the capacity to test anyone with symptoms compatible with COVID-19 for COVID-19. Healthcare providers really need to know that the Utah Department of Health recommends that anyone with fever, cough, or shortness of breath, no matter how mild, should be tested for COVID-19. This is essential information that we need as a public health agency in order to continue to contain the epidemic here in Utah. Okay, I'll take questions.
Hi, thanks for taking the time. Can you speak just a little bit more about masks and your recommendations for those?
Sure. So we're aligned with the CDC recommendations in terms of wearing homemade or cloth masks. They should be used in instances where social distancing of greater than 6 feet away from individuals is not possible. Social distancing is still paramount to containing this outbreak, but there are instances such as, going grocery shopping, going to a pharmacy, where it might be really hard to maintain that 6 feet distance. And in those instances, it can be helpful for individuals to wear a homemade mask. The masks are for preventing asymptomatic or pre-symptomatic spread. So they will prevent you from spreading your germs to others, but it won't necessarily protect you from getting the illness. So if you're over 60 or in a high-risk category, social distancing is still very, very important, especially for those people, so that we don't spread disease to the most vulnerable.
Hi, Dr. Dunn. The University of Utah statisticians are projecting that today will be the peak of the virus in Utah. Do you agree with that projection?
Sure. So there are a lot of models out there, both internationally, nationally, and in Utah specifically. I had a colleague today that said that no model is perfect, but some are useful. So I think that's kind of how we have to look at all of these models, is what information can we gain from them that will help us in our response planning. What we have been learning from all the different models is that there's quite a bit of variation, but social distancing is working at keeping our numbers low and our case counts low. We are certainly preparing for a higher peak in the event that we do see a medical surge need or we do overwhelm our healthcare systems. We want to be prepared for the worst case scenario, but it is tough to predict exactly what's going on.
Hi, thanks for taking my question. I think you announced yesterday that now we're going to be able to test everyone with symptoms. What has been the result of not being able to do that up until this point?
Sure. So at the beginning of this outbreak, we had very low capacity to test, and that was because of the supplies that are needed to actually run the test were limited in quantity, and that was a national shortage. Now we have been able to work with national partners to increase our capacity to test, both with our supplies and our laboratories. So Utah Public Health Laboratory, ARUP, Intermountain, and TestUtah.com now all have labs that have been stood up and able to run the tests. So this increase in capacity has been great for us to be able to understand kind of the more mild symptoms. Our beginning numbers were those who were hospitalized and had more severe symptoms. So being able to broaden this has allowed us to understand the burden of disease among kind of younger age groups and those with more mild symptoms.
What does that do in terms of the spread of the virus?
So definitely, testing is a cornerstone in our response efforts. And what testing allows us to do is identify individuals with the virus, do case investigation, and identify all of their close contacts and make sure they're isolated or quarantined if needed. So the response definitely relies on this. I think by not having that huge capacity at the beginning of this outbreak means that we could have had more spread that maybe could have been prevented if we had broad capacity to test it early in this outbreak nationally.
Got it. Thank you.
Yeah, Dr. Dunn, when are you expecting the peak to be? Once again, where are we at when it comes to just flattening that curve?
Sure. I mean, again, this is a novel virus, so we only have a few weeks worth of data in Utah to even put into a model. And so we're trying to predict, several months out with only a little bit of data comparatively. So we are predicting for a surge in needed healthcare and hospital beds. We are working to make sure that we are preparing our healthcare systems so that they can deal with any surge if that indeed happens. But we don't have a good prediction, if you will, but we are preparing now in the event that any day we could see a huge surge.
Hi, Dr. Dunn. My question is more sort of broad-based. If we are going to concede that there has to be a balance between physical and mental wellness, many public places like national parks are closing down, which have a wide open space in many areas. Well, at the same time, we have more golf courses today even opening to the public. Should we be waiting a few more weeks to open some more of these public spaces? And what does that say about the psychology of potential mixed signals here to the public?
Yeah, I mean, definitely a big intervention in Utah and nationally for controlling this pandemic is social distancing. We have the stay home directive from the governor that everyone should be following, that we should be staying at least 6 feet away from people and not going into crowded or public spaces if we don't need to. That's essential to solving this pandemic. It is, though, as you say, kind of this balance between that mental and physical wellness with also preventing spread of disease. So we need to find ways to get outside, to move around, and keep our physical and mental self healthy while also still maintaining distance from each other. That's going to be crucial because we're still at the very beginning of this. Our cases are still on a linear growth. We haven't seen kind of that huge surge. And so that means that we might be at the beginning of this and still might have several more weeks or a couple of more months of needing social distancing.
So just a quick follow-up. I mean, if politicians are seeking advice from the health department, is it wise right now during this very, very critical time to be opening up more public places like this?
Yeah, so we work directly with our local health departments who work with their elected officials, and at the state health department, we work with our state elected officials to provide them the best health guidance and public health recommendations, but know that there are a lot of different aspects that go into making policy decisions, and our elected officials do the best in terms of weighing all those positives and negatives and coming out with the best recommendation.
Okay, thank you.
Sure.
going back to testing, you said people with symptoms, fever, cough, shortness of breath, there's enough capacity now. But are you looking for people who have all three symptoms, or if someone says, hey, I've got a fever, I should go get tested, would you recommend that?
Yeah, absolutely. Thank you for that clarification. Just one of the three symptoms you should get tested. So fever or cough or new shortness of breath, contact your healthcare provider via phone call or telehealth to get connected with the appropriate testing site for you.
Gotcha. And as a follow-up, as far as the test itself, up until now, it's some people say it might be invasive. It's that big thing going into your nostril, lack of a better term. Is that changing? Is there a quicker test? Is there a simpler test coming?
Yeah, so the gold standard of identifying virus in somebody is a nasopharyngeal swab. So basically a long Q-tip that goes in your nose and takes the specimen. There are other tests being developed by a variety of companies and scientists across the country. None of them have been completely validated as of today in terms of the same accuracy as that gold standard. So FDA and our academic partners and our federal partners are working to get kind of more rapid or quick testing that may be less invasive kind of on the market, but we don't have anything as of today.
Yeah, Doctor, eventually, the social distancing, I don't want to say it has to come to an end, but the measures that we're taking as far as closing restaurants, closing, say, nail salons and tattoo parlors, eventually those are going to come to an end and schools are going to reopen again. So when that happens, how do we know we're not going to see like another large wave of coronavirus infections going around when that happens?
Yeah, so the Department of Health is actively working with the governor's office in order to identify how to slowly reopen, schools and businesses so that we do a more slow rollout. So it's not kind of all shut down and then all open. And so hopefully with kind of that slow rollout, we will be able to minimize that potential for a resurgence in cases.
Good.
Hi, Dr. Dunn. A couple of things. First off, with the deaths, wanted to confirm just what you're saying earlier. Two of the three from Salt Lake County have been in long-term care, or one of the three?
Two of the three from Salt Lake County were in long-term care facilities. They were each in different long-term care facilities.
Okay, and then were either of those long-term care facilities ones that you'd where previous deaths or previous cases have been reported?
Sure, yeah, they were both in facilities where we had known outbreaks and we were investigating.
Okay, and then there was an article in Fast Company 2 days ago talking about that the state is going to try to start randomized tests of residents, whether they have symptoms or not. This was, I think, based on sort of the first reports out of the Test Utah website. Is the idea for randomized tests still happening, or is that what is the plan currently where that's concerned?
Sure. So we actually just had a call this morning with the CDC, the State Health Department, and representatives from our Governor's Office of Management and Budget to discuss this issue exactly. There is utility in understanding the prevalence or how much disease spread there is in a community. It's just coming up with the kind of best way to do that so that we get really good information that we can make decisions on and act on. So those are still in the planning phases, but we are working with all of our partners to try to figure out the best way to do that.
Okay. And then regarding the idea of going outside, when it's a sunny weekend, what does the health department recommend for people who are looking to possibly go outside and go hike or whatever? And then what do you personally, what's your personal regimen as far as being prepared for going out to outdoor activity?
Sure. I mean, outside is one of the safest places we can be. The virus is known to transmit less in the open air, and especially when it's nice outside, it's good for you mentally and physically to get outside. It's really important to stay away from crowded areas. So we don't want congregation of large groups in any area, even if it is outside. So if you'd like to go outside, go for a hike, do so with people that are in your household, so people you're already exposed to. Limit your exposure to anyone outside of your household, and try to go at non-peak time, so earlier in the morning or later in the evening, just before sunset. Go to a trail that's not as crowded, and that will definitely help prevent the spread. And I do similar things on the weekend when I have time, trying to get outside, but again, follow those same recommendations in terms of off-peak hours, going by myself or with my family members, and staying away from crowds.
Okay, thank you.
Sure.
Hi, Dr. Dunn. I just saw an article from a couple days ago talking about how some like big box stores such as Walmart and Target are in other states across the nation, stores in those areas are being asked to basically not sell items that aren't essential, such as, you know, clothing and things of that nature. Are you aware of anything like that being talked about here in Utah, or is that anything you guys have discussed at the state level?
Yeah, not to my knowledge, we haven't discussed any kind of state-specific regulations around that. Again, we are kind of keeping that a little higher level in how businesses can reopen safely while there still is COVID in the community, so that we can not only protect Utahns against COVID, but also try to reopen the economy as much as we can in a safe way. So those discussions are ongoing, but no specific regulations or recommendations as of yet. Okay, thank you guys so much. You come back up.
Good afternoon, ladies and gentlemen. It's great to be here with you today. And just let me start off by thanking Dr. Dunn for her leadership and Department of Health and everything she's accomplished there, and as busy as they've been. Working with the Department of Health through this entire issue has been something extraordinary coming together at a state level. I can be a witness to that, but also just to also appreciate and thank the governor for his leadership as we've sat in many of these meetings and consultations as we talk about the policies and the issues of best guidance for going forward for the state of Utah. Know that is first and foremost our intention with all that we do, of being able to address the needs and the safety and the concerns of all of us here in the state. As you remember, a couple of days ago, we actually announced the addition of a couple more tools that's going into place as far as an executive order on our ports of entry. Since that time, we've had a few questions that have come up and points of clarification that's been needed to be given. Those ports of entry have gone live this morning at the airport, as well as 9 different points throughout the state coming in on our roadways. Just know that the whole effort here of what we're trying to accomplish is, in fact, the ability for us to gather critical information that is going to help those who are affected by this coronavirus and or protect those who are not yet affected. And so know that the health and safety of the people of the state of Utah is foremost at the front effort of what we're trying to accomplish. And so today we'll have John Gleason from UDOT with us who can talk to the operations of that, as what we're seeing at the airport, as well as coming in across the ports of entry on our roadways. But just let me clarify a couple of points of emphasis. What we're trying to accomplish here, especially motoring public coming through on our main thoroughfares, will not impede traffic at all. The simple aspect of what is established and what is set up is those vehicles will receive a safety alert, a notification alert that will come through on a cellular device that then will ask them to be in compliance with and follow the orders that are given to them through that notification. Commerce continues. It is not to affect commerce or the trucking industry as far as coming and going out of the state and getting commerce and goods to where it needs to be. That will continue to go forward. And so essentially using electronic means by notifying drivers is quite an effective and efficient way of using a system that we have as far as the alert notification system, but yet a new program in the way we're trying to implement it to something that's already been established for some years. And so we would ask you to be patient with us, as this is still going to be some adjustments and modifications made as we refine, or otherwise sometimes you may receive, some of you who are innocent and not wanting to receive those notifications may receive a notification at either an untimely event or time of the day. Just work with us and please be patient with us. We'd also ask you to let us know as we continue to refine that process and how it would best be in practice. So along that, some adjustments as well to the original executive order. Some exemptions that have come to our knowledge, and as well as something we need to implement, will be effective as follows. Exemptions will be given to commercial airline employees coming into the Salt Lake City and the state of Utah through the Salt Lake City Airport. All commercial motor carrier drivers, the public safety personnel coming and going, active military will be exempt, our healthcare providers are exempt, and even our workers who are going back and forth across the state line, those we've heard from many of you who live right on the border of the state line and go back and forth. You too are exempt. Now, knowing that you may be exempt from filling that out every time, you will still possibly receive the notification. But know that if it is of our best interest and all best interest, any of you who are exempt, as soon as you do display any signs or symptoms or otherwise exposure to the COVID-19, that we would ask you to still be in compliance with what we're asking everybody else. Please pay attention to that and this voluntary compliance to participate so that we can make sure that the health and the safety of all of us are protected is the best effort here. So with that, I just want to conclude with my remarks by simply saying that everything that we are doing from our operations center is 24/7. We are tracking, monitoring, trying to best predict as well as understand the gravity of the situation as we go forward to make those good decisions and recommendations all the way up to the governor, that we can then continue to model this the best way and be one of the best leading states in the nation to overcome this and drive out of it. So with that, I'll turn the time over to John Gleason for some comments about the operations piece.
Thank you, Commissioner. Thank you. It's great to be here. I want to let you all know that we at the Department of Transportation are doing everything that we can and using every tool possible to help stop the spread of COVID-19. As an update to the efforts surrounding Governor Herbert's executive order, UDOT started distributing the travel declaration postcards just this morning at Salt Lake International. We were out there about 7 o'clock this morning, and in just the past hour, via text message, we have begun notifying those folks that are coming into the state via those 9 designated highway routes. Members of the UDOT motor carriers team who have experience working as law enforcement officers at our points of entry, they're stationed immediately outside of the security exits at terminals 1, 2, and the international terminal when necessary. We're working in groups of 2, and they're going to be out there from the hours of operation are from 7 a.m. until 1 a.m. So there'll be 2 different shifts out there. They're wearing masks and gloves to protect themselves and to protect those people that are coming off of the plane. And they're distributing the postcards with a QR code and self-declaration instructions, what's expected of them. Because the technology won't allow us to pinpoint the people who are coming off of the airplanes whose destination is Utah, it's necessary for us to distribute these postcards rather than the text messages that everyone else coming into those different access points are going to receive. I've got to say, so far, these efforts have been very well received, and there's been a tremendous spirit of cooperation. And I realize this is just a snapshot, but everyone, all of the passengers who have gotten off the plane No one has refused a postcard. They've all been appreciative of the work that our folks are out there doing, and I think it's a way that people can do their part, and this is something that we can all do to help stop this virus. We're grateful to everyone who's working with us to follow the requirements of the governor's executive order. We know that this is going to help spread COVID-19 and to help flatten the curve. It's important to reiterate the purpose of this action, which is tracing, informing, and isolating. As far as tracing is concerned, in the event of someone who enters the state becomes infected with COVID-19, this information, this critical information, their self-declaration will allow the Utah Department of Health to work with the airlines and other parties to more quickly and effectively trace and identify those who may have come into contact with this individual. With this information, we can then more quickly and effectively inform those who may need to be notified so that they can take immediate action. And once that notification is made, isolating. They can make the decision to self-isolate so that they're not spreading this virus to their loved ones and friends. These forms are simple to fill out. They take less than 5 minutes, and yet they're going to make a huge difference in our ability to stop the spread of COVID-19. We're appreciative of everyone who is doing their part. It's incredibly reassuring and inspiring to see how our state government, community, and everyday Utahns all across the state are pulling together and stepping up during these challenging times. Let me reiterate, we're doing everything possible to keep people safe. And by working together, we can stop the spread of this virus. Thank you.
Good afternoon. I'm Joe Dougherty, the Public Information Officer for the Utah Division of Emergency Management. Today, Utah had a chance to do something unique in that we deployed a wireless emergency alert along these 9 routes that have been identified in the state. We are the first state to do this for coronavirus, to be able to alert the public that there is some action that we need them to take. We've received a few questions about how this technology works. And really, it's very simple. We draw a number of shapes, we call them polygons, on a map, and then we write a 90-character message that then has been sent out. That went out at 12:37 this afternoon, and we've already received a few reports that it has been successful. And so we are grateful that we have access to this type of technology. Very simply, people who enter the area that has been geo-targeted will, if it works the way it's supposed to, we'll receive that alert. And we're very confident in the technology. So that is really all that I had. If there are any questions for me, John, or Commissioner Anderson. Thank you.
Well, thank you. And both what UDOT as well as DEM, Department of Emergency Management, pushing that out this morning has been very effective, and our partners. So with that, we'll take any questions.
Hi, thank you for taking the question. We have heard some concerns from the commercial truck industry that this could be really burdensome on folks, especially if they're just traveling through, having to remember all the places they've been for the last 15 days when they do so much traveling, that it could be something really challenging for those people. Did you have any thoughts on that?
Yeah, actually, so that was an effort that we've been working with, is our trucking industry in our association. As we've definitely hear their concerns, we're sympathetic to it, and also understand that we don't want to do anything to inhibit commerce going back and forth, or otherwise to slow that down, especially right now with our supply chain issues and the demands of that. Hence, that is the reason why we have included them in the exemptions, that they will be able to come into the state and not have to fill out the declaration.
Okay, yes. Sorry about that. A couple questions here. Who is the company that is putting this in place? What does this piece of technology look like? Is this new, or has this always been in place? We're just now activating it. How did they get our information? Will this company be storing our information, or does it just go to the health department? And how long will this information be stored? And how is it protected and secured?
Okay, we'll let Joe Dougherty answer that question out of Division of Emergency Management.
We appreciate the question, Brittany. So there are actually a couple of answers to your question. The first part is the technology that is being used to deploy the technology is a software system that we've been using in emergency management for a number of years. It's called Web EOC. It's one of the many software providers that can reach the Integrated Public Alert and Warning System, which is the system set up by FEMA and the FCC to be able to send critical alerts to people in emergency times. And we are under a state of emergency right now. That system does not track your data at all. It uses a technology called cell broadcast. So a normal SMS text message, there is a connection between the sender and you, and the sender knows when you receive that message. With cell broadcast, the message goes out to cell phone towers, and then cell phones that happen to enter the geofenced area are pinged just with that alert. And so we retain no data on cell phones. We won't even know how many people actually received that message, but we are confident that it works very well. As far as the data that's collected on the form, that data will be collected and given in a secure fashion to the Utah Department of Health so that they can track that and trace any movement of someone who has coronavirus in the state. Thanks.
Thank you. This is Michael Orton with the Capitol News Service. Still needing a little clarification on the exact effort on the part of the public. Is this going to be voluntary compliance? Because the way that some of the responses have been given in this press conference here is still rather unclear. And the other thing is that if these cards are given at the airport, are they going to be collected within that 5-minute approximation of time to fill them out, deposited somewhere without relating to identity? How's that working?
Yeah, so a lot of the great questions that continue to come up, so appreciate your question. The information is voluntarily at this time. It really is the fact that as vehicles drive across the border or as people come into the airport and are given that information, what we're asking for is voluntary compliance due to the health order that's been issued by the governor. And so under that, that is simply going to be held at that level of volunteerism, volunteering that information to make sure that we have the ability to continue to track and or trace or help individuals as they come into the state to receive that care, level of care that they are in need of. As far as the airport and the processing at the airport, as individuals come through that checkpoint and receive that card, simply on that card is a QR code that they will need to scan with their phone, and then therefore it'll take them right into that same website that will come across if you were coming in the state in your vehicle. It's through that QR code that as they scan that they can access that information that we are requesting for the health department to begin to follow up with them if there is a need.
Thank you.
Looks like there may be some glitches that have been kind of happening. It sounds like maybe some people who weren't supposed to get the alert may have gotten the alert, or some people that should have gotten didn't get it. Matter of fact, we have somebody that works in our office who said he drove to Wyoming, did not get the text message, but that could be because maybe he drove before this thing started. But apart from those, what other kinds of glitches do you guys see needing to be fixed?
Let me have Joe address that.
Hey, Paul, great question. So the ones that you identified there are the normal glitches that can happen with this software. It is meant and is increasingly precise, but there are times where a cell phone tower that is well outside of a designated alerting area may still receive that message and may broadcast it. Now, according to everything that we've heard today, we have heard no reports, at least directly to us, of people who were not supposed to receive this alert. There are some people who ended up who missed it because they went a little early. Like I said, that alert was pushed at 12:37 p.m. today. And so anyone who is traveling in those state line areas of the state of Utah should receive them. We've heard from other local news media who were in the Idaho area who did receive the alert as well. And I believe we heard something similar from some of our UDOT folks as well. Thanks.
Thank you. And this is probably a follow-up with Joe. The cell tower, the geofencing, just a little more clarification on it. Let's, in a place like St. George in southern Utah, which is right on the border, and you can literally drive to a Walmart and you're right next to the port of entry, is it going to be a situation where people are going to be, let's say, leaving their homes, coming back, and constantly getting this message, or is it just at one time? How does that work exactly? I mean, are people just going to be have to live with getting this message over and over again?
Well, fortunately, we worked with our partners in the state of Arizona, and Arizona gave us permission to draw our alert area in the Virgin River Gorge area, so right up until just over the state line of Utah. And so we're doing our very best to keep the alert out of any residential areas. Again, the technology is becoming more and more precise, but we can't guarantee that there are some people who might receive this message who shouldn't. Typically, what's supposed to happen is if your phone receives the alert one time, it is not supposed to receive that alert again. However, the alert does need to be reissued each day because the federal regulations are that a wireless emergency alert can be active for 24 hours only. So we're going to do our best to make sure that alerts do go out at the right time and that we're hitting the right people driving through those areas. Hopefully that answers your question.
It does. Thank you.
Okay, last question.
Carter with the Times Independent and Mod. So this is a little bit redundant, I apologize. Filling the form was initially announced by Governor Herbert as required. And further clarification, since that announcement, make it clear that there will be no manned checkpoints on Utah roads and that motorists won't be stopped if they do not fill out the form. And in this press conference, the word voluntary has been used to describe it. So is filling out the form for people entering Utah voluntary or required?
Again, that's as we addressed. This is a voluntary action. We're calling upon all the citizens who drive into the state of Utah or otherwise land at the Salt Lake International Airport to comply with the order by voluntarily going on to the website and filling out that information, making themselves either known to us or the condition in which they have suffered as it is concerning the COVID-19 coronavirus. So that is the conditions right now. And best, as I mentioned in my remarks earlier, this is the best approach that we can give in the effect of not having to have our ports of entries manned with manpower and extensive needs that would take. And so if we can see that we're getting good results from this, as people continue to comply with that, we continue to drive down the curve, we can continue to get good results with what the overall message of what we're trying to accomplish with this. That is something we'll be paying very close attention to. And we'll continue to adjust as needed if that is in fact the case. That is part of the policies and the principles that we're constantly in communication with and analyzing on a daily basis. And so as we continue to monitor that, we'll be able to continue to control how this goes forward to protect the people of Utah. With that, thank you so much for being here today. We appreciate your time.
Thank you.
Thank you again for your participation today. That will conclude today's briefing. We're grateful to Commissioner Anderson, to Dr. Dunn, and to Joe Dougherty and John Gleason for being with us. There will be no briefings over the weekend. We look forward to seeing you here again on Monday, and we hope you have a wonderful weekend. Thank you very much.